Today, we're diving into a massive government initiative that was designed to be a lifeline for literally millions of children all across India. We're going to uncover the story behind a program called RBSK, and we'll look at both its incredible promise and, its real-world challenges.
Okay, just imagine for a second hearing that a life-saving surgery for your child is going to be completely 100% free. For a family with just no way to pay, those words, they might sound almost too good to be true. But for one family, it was a reality.
You see, a young boy named Harshad was diagnosed with a pretty severe heart condition. It needed immediate, very expensive surgery. And for his family, who were already struggling financially, this diagnosis was just devastating. It really felt like hope was completely out of reach.
But here's the thing. Harshad got that surgery, and it didn't cost his family a single thing. His story is just one example of a really powerful program that's been quietly working across the country. So what is this program that gave him a second chance at life?
Well, the program is called the Rashtriya Bal Swasthya Karyakram, or RBSK for short. And it's a really ambitious mission with a super clear goal: to protect the health of India's next generation.
So here's the big idea. It was launched back in 2013, and the concept is actually pretty simple, but it's so powerful. Catch health problems early and then intervene. The program covers every single child, right from the moment they're born until they turn 18 years old. Okay, but that's a huge age range, right? Birth to 18. So how do they focus their efforts? What are they actually looking for when they screen millions and millions of kids?
Well, the whole program is built around this brilliantly simple framework. They call it the 4 Ds. First up, you've got defects at birth, so congenital conditions. The second D is for diseases, the common stuff kids get. Third is deficiencies, things like malnutrition or anemia. And the fourth D is for developmental delays and disabilities, which covers everything from speech issues to learning disorders. It's basically a comprehensive health check for a child's entire well-being.
So that's the framework. And it sounds great, right? But having a great plan is one thing. Making it happen is a whole other story. How does this program actually reach children in all these villages and schools across the country?
The real frontline workers of this whole program are the mobile health teams. You can almost think of them as a doctor's office on wheels. Each team usually has 4 professionals, 2 medical officers, a nurse, and a pharmacist. And their job is to travel out into the communities to do the screenings.
The journey for a patient follows a really clear path. It all starts with that screening at a school or a community center. If the mobile health team finds a potential issue, that child gets referred to a specialized place called a District Early Intervention Center, or DEIC. And here's the most crucial part. From that moment on, all the care they get, therapy, medicine, even major surgery, is absolutely, completely free.
Okay, so we know how it's supposed to work. But what's the actual impact been? Let's take a look at the numbers. And honestly, they are just staggering.
The sheer scale of this is hard to even wrap your head around. Between 2013 and 2021, the program did over 1 billion screenings. No, that's not a typo, 1 billion. It is easily one of the largest public health screening efforts anywhere in the world.
And from all of those screenings, more than 80 million children were flagged as having a potential health condition, one of those 4 Ds, that needed a closer look.
And of that group, get this, over 31 million children actually went on to get the free advanced care they needed. That is millions of stories just like Harshad's, all made possible by this system.
Now, to make all of this treatment possible, the government set up 315 of these specialized district early intervention centers all over India. They really built the infrastructure needed to turn those referrals into recovery.
So, the national numbers, they paint a picture of incredible success. But as we all know, policy and practice can often be 2 very different things. What does it actually look like for the families and the health teams on the ground?
A study from a rural part of West Bengal gives us a really valuable snapshot. It found that after a child was referred for more care, only about 63% of them actually made it to the specialized centers. That means a huge chunk, more than a third, were falling through the cracks. So why?
Well, it turns out the challenges come from both sides, and they reveal some deeper issues. For the parents and caregivers, even if the treatment itself is free, the journey to get there isn't. They're facing costs for travel, they're losing wages from taking time off work, and they're dealing with really long waits at hospitals that are already overwhelmed. At the same time, the health teams themselves are stretched incredibly thin. They're facing staff shortages, tough travel to remote areas, and a massive amount of paperwork that pulls them away from actually caring for patients.
And listen to this quote from a team member in that study. It just says it all. They said, "We do not have sufficient manpower for our block size. We have to manage all the data entry and reporting ourselves." You can just feel the strain they're under on the front lines of this program.
All of this really points to a central tension here, right? It's the gap between the incredible promise of RBSK and the challenging reality of how it works in practice day to day.
On paper, and in so many real-world cases like Harshad's, RBSK is a truly visionary program. It's a lifeline, designed from the ground up to make sure that no child's future is limited by a health condition that we can treat.
But, and it's a big but, as we've seen, there is a wide gap to cross. These operational hurdles, things like staff shortages and travel costs for families, are stopping the program's goals from being delivered to every single child every single time.
At the end of the day, a lifeline is only effective if you can actually grab onto it. The challenge for RBSK isn't its vision. That part is remarkable. The real work now is in strengthening its reach, making absolutely sure that its promise becomes a reality for every single child.